COPD. What is it? Well, it stands for chronic obstructive pulmonary disease. So chronic meaning it doesn't go away. Obstructive describes how difficult it is to breathe. And pulmonary disease means it happens in the lungs. So before we get started, let's take a look at how the lungs function. They consist of a spongy network of airways called bronchioles and air sacs called alveoli. So when we take a breath, the air flows down the bronchioles that become smaller and smaller, ending up at the alveoli. This is where carbon dioxide moves out of the blood and oxygen moves in. So COPD causes inflammation to the lungs, causing permanent damage to the airways and the air sacs. COPD is also an umbrella term used to describe emphysema and chronic bronchitis. People with emphysema are also known as the pink puffer because they have trouble breathing but are well perfused. And people with chronic bronchitis, also known as the blue bloater, because they usually have cyanosis, which is a blue tinge to the skin. Some common signs and symptoms of this illness are dyspnea, productive cough, wheezing, and chest tightness. For someone with only emphysema, will have a barrel chest, atrophy, and pursed lips. For those with only chronic bronchitis, they can have peripheral edema and a raised JVP due to heart failure on the right side. Okay, so now let's take a look at how emphysema and chronic bronchitis affect the lungs. With emphysema, it is tiny functional units deep down into the lungs called the alveoli that are affected. They are covered with elastic fibers, allowing them to inflate and recoil as we breathe. But when emphysema is present, these elastic fibers are reduced, causing a loss in surface area, potentially leading to a collapsed alveoli, resulting in air being trapped in the sacs as we exhale, because the recoil mechanism is damaged, making it difficult to get the oxygen needed. With bronchitis, with chronic bronchitis, it is the bronchioles that are affected. This is the inside of a healthy bronchiole with smooth muscle tissue and mucus. And what happens with chronic bronchitis is there's smooth muscle hypertrophy and contraction, as well as excess mucus production, making it difficult to breathe. Common risk factors of COPD are smoking, advanced age, a low socioeconomic status, genetic factors, pollutants, and abnormal lungs. Coping with COPD. A great way to slow down the progression of COPD and improve quality of life is through pulmonary rehabilitation. It's tailored to your needs, and that may include chest therapy to overcome breathlessness and manage phlegm, regular light exercise, and nutritional advice because weight loss is common in COPD. Counseling is available to help with motivation levels and anxiety, along with support groups to connect with others sharing the same experiences, questions, and feelings. Here is a local resource I found here in Windsor. Some additional information on this program is it runs for 16 weeks, 3 times a week, 2 times a week for maintenance. A respirologist referral is needed. People who attend this tend to suffer from alpha 1, COPD, lung cancer, pulmonary fibrosis, pulmonary hypertension, and there's a few more on the list. program offering, so you'll be able to be assessed, you will get educated, you will exercise along with a maintenance program and follow-up. So thank you very much for watching, and I hope you learned something today.